Another hospital chain operator created by the human parasites in the private equity industry has just filed for bankruptcy. This time, it's Prospect Medical Holdings, the brainchild of PE firm Leonard Green & Partners, that's filed for Chapter 11 after spending the last 13 years or so gobbling up more than a dozen hospitals in 5 different states, all while making empty promises of investments in those hospitals and instead taking out huge debt against those hospitals, using that debt to pay themselves hundreds of millions of dollars in dividends, then running those hospitals into the ground, not paying their bills, killing patients along the way, before ultimately filing for bankruptcy. What's up, guys? I'm Nobody Special, and we got this one in CBS News dated Saturday, January 11th. Prospect Medical Holdings files for bankruptcy after owners took hundreds of millions in payouts. A Los Angeles-based company that owns more than a dozen hospitals in 4 states filed for bankruptcy late Saturday night, the second major system acquired by private equity to collapse in less than a year. Ironically, this bankruptcy comes just 4 days after this one. Senate report blasts private equity's role in healthcare. A bipartisan investigation said asset managers Apollo and Leonard Green likely weakened hospitals they control. Now, Prospect Medical was purchased by private equity firm Leonard Green & Partners in 2010 for $205 million. And thus began a decade of aggressive expansion by Prospect Medical, where the pattern would go a little something like this. Prospect would move into an area and announce that they're going to rescue struggling hospitals. State and local regulators would always express doubts about having an investment firm come take over their area hospitals, and so the private equity firm and Prospect Medical would make all kinds of promises about investments in the hospital, and they'd swear up and down that they were never going to close these hospitals. Those empty promises were typically enough to get the deals done, and then as soon as the deals were done, Prospect would start immediately borrowing against those hospitals. They would take out huge amounts of debt, and what would they do with that debt? Well, they would pay themselves dividends, hundreds of millions in dividends. And of course, then would start the excuses and all the legal haggling, all the reasons why they can't make the investments that they promised to make, in some cases letting hospital pensions go insolvent. Prospect would also stop paying their bills and stop maintaining their hospitals, ultimately running them into the ground, and in some cases killing patients. And this article from ProPublica in 2020 details what it looked like at some of these Prospect hospitals. Investors extracted $400 million from a hospital chain that sometimes couldn't pay for medical supplies or gas for ambulances. Now, this article goes on for days and days about all the crooked things that happened at Prospect's hospitals, about how they were ripping off Medicare, about how they were letting patients wander out of the hospital and they would find their bodies days later drowned in the beach. But here's just a couple of examples of what life was like inside these hospitals for patients and for staff. At the company's flagship Los Angeles hospital, persistent elevator breakdowns sometimes require emergency room nurses to wheel patients on gurneys across the public street as security guards attempt to halt traffic. Paramedics for Prospect's hospital near Philadelphia told ProPublica that they've repeatedly gone to fuel up their ambulances only to come away empty at their pump. Their hospital-supplied gas cards were rejected because Prospect hadn't paid its bill. Say we need 4x4 sponges, dressings for a patient's IV fluids, said Leslie Haygood, a veteran registered nurse at one of Prospect's Pennsylvania hospitals. We might not have it on the shelf because it's on credit hold because they haven't paid their bills. This ProPublica article also details an elaborate scheme to defraud Medicare by busing in elderly patients from all over the state to their emergency room in order to squeeze every ounce of payment from the government out of these people. And in one case, a patient died. Here's Don Andrews, a former administrator at one of these hospitals, describing the scheme. He says this routinely resulted in a handful of patients being held for days in a crowded emergency room overflow area with no beds or privacy, just chairs and a single bathroom, serving as a sort of bootleg inpatient psychiatric unit. A few years before Andrews got there, one 79-year-old man suffering from dementia disappeared after being left unattended in the overflow area. According to a state inspection report and a lawsuit by the family, his body was later found on a beach 7 miles away. The man had drowned. Now, the key to this scheme is the dividends that Leonard Green & Partners, along with the executive staffs at Prospect Medical, would routinely pay themselves. And those dividends were no small amounts. From 2012 to 2018, more than $645 million in dividends was paid by these hospitals to Leonard Green Partners investors along with the executives at Prospect Medical. 386 of that $645 million would go to Leonard Green Partners investors. Another $14 million would go to Leonard Green Partners for management fees. But if you really need a name and a face to put on this story, look no further than this blood-sucking vampire named Sam Lee. He served in one capacity or another, either as CEO or a board member at Prospect Medical since its inception. And since 2012, Sam Lee has personally collected over $128 million worth of those dividends from the hospitals run by Prospect Medical. Another important name at Prospect Medical is this guy, David Topper. He personally collected $94 million of those $645 million in dividends. Now, here's David Topper shown bearing an uncanny resemblance to healthcare executives all across the country who have all adopted a similar look ever since a trust fund baby with a unibrow decided to stalk and murder a United Healthcare executive on the streets of New York just a couple of weeks ago. Apparently, $94 million is enough money to have your face scrubbed from the internet. And rounding out that $645 million in dividends was another $37 million that was paid out to various other executives at Prospect Medical. Now, by 2019, Prospect Medical could read the writing on the wall. They were over $1.5 billion in debt at this point, and they knew it was just a matter of time before they filed for bankruptcy. And that is when they rolled out one of the oldest tricks in the private equity playbook, the Sale-Leaseback agreement. After closing several unprofitable hospitals, Prospect Medical would take the remaining buildings that they still owned and they sold them to a real estate investment trust called Medical Properties Trust. That's the same Medical Properties Trust that's at the heart of the bankruptcy of Steward Healthcare, something I've talked about in this channel at great length. In a sale-leaseback agreement, they basically sell the buildings to Medical Properties Trust. They got $1.55 billion in exchange for those buildings. Now, they use that $1.5 billion to pay off their debt, but now Prospect Medical needs to pay rent to Medical Properties Trust, and so immediately Prospect Medical starts acquiring new debt because they can't make those rental payments, and ultimately it's those rental payments that have been bankrupting hospitals all over America in these last few years. It led to the bankruptcy of Steward Healthcare and now the bankruptcy of Prospect Medical. So long story short, you can add Prospect Medical Holdings along with Leonard Green and Partners and Sam Lee and David Topper to the long list of parasites that have been bleeding our healthcare system dry. These guys are the reasons why the cost of healthcare keeps going up, even though the quality keeps going down, and we keep losing hospitals almost exclusively in poor areas where people have no other option where to go. That report from the United States Senate condemning their actions is a start, but all of these companies have a lot of lobbyists and politicians in their pocket, so it's a good bet this is probably going to continue for quite a while until things get so bad that legislators are forced to act. Till next time, live small and dream big.